Hi, this is Dr. Dean Kelaita, Calaveras County Health Officer, with a COVID-19 update for today, September 1st, 2020. Start off with some statewide figures. Statewide, California has reported 704,085 confirmed cases of COVID-19, novel coronavirus infection throughout the state, with 12,933 fatalities. Calaveras County, according to our public health department, of which I'm a member, confirms 236 coronavirus cases. We've now experienced 2 deaths among residents of our community. The most recent death was reported last week. This was in a middle-aged female resident of Calaveras County who was hospitalized in a neighboring hospital in the San Joaquin Valley. This was reported on August 21st. Since that time, there have been no other confirmed deaths in our community, although we are going through some statistics and may have some other announcements as the week unfolds. We are experiencing a significant issue in our community since our last update. An outbreak of COVID-19 infection has been identified in the Avalon San Andreas Skilled Nursing Facility. This is our county's only nursing home. That's a SNF, a skilled nursing facility. There was the initial identification of an asymptomatic staff member who was working at the facility taking care of the residents. This infection was picked up through routine surveillance testing. The person was asymptomatic, meaning that they had no signs or symptoms of infection and did not feel ill. This was identified on July 22nd. It didn't take long before we've identified additional infections among the residents of the facility. And to date, 33 residents and 18 staff members have been confirmed positive for COVID-19 infection through enhanced testing of all the residents and care staff who live and work in the facility. Any positive residents have been able to be temporarily transferred to another facility within the Avalon network of nursing homes throughout Northern California. So they've been able to be temporarily relocated out of our community until such time as they're considered recovered, until such time that they're considered no longer infectious, and then they can come back again. And this is a measure to prevent ongoing transmission of infection to other residents within the facility. The facility's infection prevention staff, they have a nurse who's an infection preventionist, has special training in with that skill set, has been working closely along with the administration of the facility with our public health department, and we've even had consultation with the state's California Department of Public Health to get their additional expertise and guidance on how to best manage this outbreak. So far, public health and the nursing home staff and the state have been very engaged in best practices in order to stem the outbreak from involving additional residents and staff. And the facility is undergoing close surveillance for the prompt identification of any new cases among the residents and the staff that care for them. But this is a significant development in our community. Not only is that a very at-risk population, but the numbers of cases in the nursing home have increased our whole county's case count. And so that's something that we're continuing to monitor very closely. Currently, there's 3 Calaveras County residents who are hospitalized. Local hospital capacity remains good at Mark Twain Medical Center for the admission of routine patients as well as any increasing COVID-19 cases, and ventilator availability is at 100%. Ventilators are the machines, devices that allow people to get assistance with breathing if their lungs are impaired by COVID-19 infection. There's a new development since last we did a taping of this. Governor Gavin Newsom unveiled on Friday, August 28th, that the state is going to adopt what they're calling a blueprint for safer economy, which will replace the county data monitoring list system, which was previously in place. This is the new system which will determine what businesses can and cannot open in Calaveras County and throughout California. So the way it works is that every county in California is assigned to a tier. There's 4 different tiers, and these tiers counties get assigned to based on their daily rates of new cases and the percent positivity in their testing. So at a minimum, counties must remain in the tier that they're in for at least 3 weeks. And the state's going to be continuing to watch on a weekly basis for new data as it develops. So data is reviewed weekly, and the tiers are updated on Tuesdays. So once we're in a tier, we'll at least know that we're going to be in that tier for a 3-week duration. To move forward, to move to a better tier, the county must meet the next tier's criteria for at least 2 consecutive weeks. So if a county's metrics, meaning how many new cases they're having and their percent of positivity in their data, if the county's metrics worsen for 2 consecutive weeks, then they might be assigned a more restrictive tier. So that's kind of the setup or design of the 4-tier system. It gives a little bit more nuance and specificity for the counties to be able to have more potential for business activities. So the tiers are purple, that's widespread, that's the worst. Then second worst is substantial, that's red. Moderate is orange, and minimal is yellow. So Calaveras County is currently assigned to the substantial tier. That's the second one from the worst that you could be in. At least we're not widespread, but we're considered substantial. And that means that starting yesterday, August 31st, 2020, some specific types of non-essential indoor business operations are going to be allowed to reopen. Some businesses will need to remain closed. So let's just kind of walk through this. Under this new framework, many recently closed types of businesses may resume activity, which is a good thing. If they do resume activity, then there are going to typically be some modifications put into place for those specific types of businesses. So let me give you some examples. Dine-in restaurant services. Those will be allowed to resume indoors at a maximum of 25% of their typical capacity, or 100 people, whichever is fewer. Additionally, movie theaters. Movie theaters can open at 25% of their capacity. Hair salons, barber shops, cosmetology practitioners, those types of personal services, tattoo parlors, massage parlors, nail salons, those may open with modifications as well. Gyms and fitness centers, that's something that's of interest to people, which is good. We want people to exercise and remain healthy. Gyms and fitness centers can resume indoor operations with capacity limited to 10%. So these are just a few examples of types of businesses that people ask me questions about a lot. For a complete listing of all the allowable business activities and the modifications for each one of those business activities, a person can look them up at the state's website, which is at the web address covid19.ca.gov, so covid19.ca.gov, or our Calaveras County website, which is covid19.calaveras.gov.us. So the best ways, and I've said this a lot, but I think it bears repeating, the best ways to avoid exposure to the virus are to do some of these now time-honored and scientifically effective practices. Stay home if you're sick. Stay at least 6 feet away from people outside of your household. Wash your hands with soap and water for at least 20 seconds. The use of hand sanitizer is an acceptable alternative to washing hands with water, as long as it's at least 60% isopropyl alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. And wear a face covering. The wearing of a face covering over one's nose and mouth when around others, either indoors or even outdoors, is a scientifically proven technique to reduce the risk of disease transmission, of COVID-19 transmission. No-cost testing remains available for COVID-19 in Calaveras County for anyone who'd like to get tested. This is at the OptumServe test site. That's the COVID-19 testing center that's located at the Calaveras County Fairgrounds at Frogtown. So this site is open is open Tuesday through Saturday from 7 a.m. to 7 p.m. And now testing can be performed on people as young as 3 years of age. So testing is available in our community. It's at no cost. It's relatively easy to access and convenient. I've done it and been there myself. A person can register in advance on their website or can call the toll-free 888 phone number that's listed on our county public health website. It's 888-634-1123. They can give you information and set up a time and a date for you to come in and get tested, and then you'll tell them how you want to be notified of the results when they're available. The results now are coming back quicker for COVID-19 testing. They were taking as long as 7, 8, 9 days. Now the typical turnaround time is going to be about 48 to 72 hours. So although the reopening of some businesses with modifications in our community is encouraging, we really need to remain cautious in how we're going to move forward in this pandemic. This is the worst pandemic that most of us have seen in our lifetimes. And to continue in a positive direction, the public is really urged to continue to wear face masks, keep 6 feet apart, maintain that social distancing that's so important, get tested, accessing the OptumServe test site at the fairgrounds, washing hands often, and stay at home if you're sick. It's important to avoid gatherings if physical distancing and mask wearing cannot be maintained at all times. So there's no doubt that our current situation is really further strengthened by adopting these principles, by getting tested, by wearing face coverings, and by doing the things that we can do together to fight against COVID-19 in our community. This will allow for our businesses and our business community to reopen, and hopefully in the near future get our kids back into the classroom, which is really where they need to be. And once that's able to be done safely, we really want to encourage schools to be doing in-person instruction for students as much as possible. For the time being, most districts are going to be doing some kind of a distance learning remotely for children until we can determine it's safe for them to get back into the school setting. So let's continue to work together, and together we can make this community safer from COVID-19 until such time that a vaccine's available to provide wider scale protection to all of us. Further information will be released from the Public Health Department as it becomes available, and our twice weekly press releases will continue to be available in the local print and online media. Thank you for your support.